Good morning, class. My name is Cameron Chu, and today I will be giving you an overview on blood groups and blood transfusions. The first section of my presentation will concern four aspects of blood typing: the ABO system, how the Rh factor is involved, the importance of the modern blood typing system, and its applications in the medical field. And finally, a basic overview as to how blood types are passed on hereditarily. So, to begin, blood classification adheres to a system that involves two main antigens that reside on the surface of erythrocytes, or blood cells. These antigens are labeled as A or B, which result in type A blood or type B blood. The absence of both of these antigens results in type O blood. The presence of both antigens results in type AB blood. Now, these antigens are important because they dominate how a person's blood will react to the presence of antibodies, which also circulate in blood. Anti-A antibodies attack type A blood, and anti-B antibodies attack type B blood. Now, these attacks are dangerous because they result in coagulation of blood cells, or erythrocytes, leading to a host of medical problems such as thrombosis and unnecessary blood clots. There is a third antigen that is technically labeled as the D antigen, but is more commonly referred to as the Rh factor, or rhesus factor. A person can either be Rh positive, where the D antigen exists in their blood, or Rh negative, where the D antigen is absent in their blood and anti-D antibodies are produced instead. A blood type is the combination of both the ABO system that I referred to and the Rh factor, giving people with blood types of both of them. For example, A positive. Now, the main reason why blood typing and the blood typing system as a whole is important is it allows doctors to perform blood transfusions, which I will touch on later. Blood typing also allows doctors to prescribe more specific and personalized drugs according to how well the said drugs perform in different blood types. As we can see, concerning blood donations, there are many different combinations of blood that will fail to be donated, if so, into a patient. For example, A negative blood can only receive O negative and A negative blood. Any of the other blood types would result in the medical complications that are referred to earlier. Now, without the presence of an antigen, here we have a basic overview on the heredity of how blood types are passed down for parent to children. As we can see, it is impossible for a child's blood type to be derived from a parent that does not contain those antigens. So as we can see, if a mother's blood type is B and a father's blood type is B, the child is bound to have either type B blood or type O blood. Not possible for it to have type A blood. Next, I will be covering blood transfusions. I will discuss the definition of blood transfusions, their importance in the medical field, and how blood donation process works. Blood transfusion is a process where blood from a donor body is extracted, usually through the median cubital vein, and then inserted into another patient in need of blood for various reasons. A few of these reasons could be low blood volume due to illnesses such as anemia, sickle cell disease, or hemophilia. Or an invasive surgery where lots of blood was lost during the operation. Now, for people in critical condition, a blood transfusion can be life-saving for them. There are generally two types of blood transfusion: whole blood versus specific components. Whole blood is a transfusion of the entire makeup of the donor's blood. This involves the erythrocytes, the plasma, and the platelets in the blood. Specific component transfusions may be just one of the above-mentioned aspects transferred into the blood. Blood transfusions have revolutionized the capabilities of the medical field, specifically concerning surgery, blood transfusions allow surgeons to perform much more intense and complex operations where large amounts of blood can be lost. As we can see, since 1993, when blood transfusions became modernized, up until 2014, this graph is a little outdated, the survival rates of major surgeries have dramatically increased in accordance with blood transfusions. As a side note, blood type AB positive is known as the universal recipient in blood transfusions, as this blood type contains no antibodies. Blood type O negative is the universal donor, as it contains no antigens and can be donated into any of the other blood types. Blood donation is what makes blood transfusions possible. Now, before one can go to a blood bank and give blood, there are many requirements for a transfusion that need to be met concerning health, such as the health of the individual, their blood type. This is very critical for the transfusion process. A simple medical history also needs to be performed in order to ensure the viability of one's blood once transfused into the patient. Blood is then drawn after these tests and checks using a sterile needle by way of the median cubital vein, which we can see here is the venous structure of the right arm. A tourniquet can also be placed on the upper extremity in order to aid blood flow in the transfusion. Now I will be talking about the pathology erythroblastosis fetalis, beginning with the risks and the description of the pathology, and then the known cures and preventative strategies that medical professionals have developed. To begin, erythroblastosis fetalis is a condition where an Rh negative mother conceives an Rh positive child. This is referring to that D antigen that I spoke about earlier. Now, in erythroblastosis fetalis, the mother's Rh antibodies attack the baby's Rh antigens. Erythroblastosis fetalis can also arise from an ABO blood typing incompatibility. The symptoms of this pathology are swollen, pale, or jaundiced children after they have been delivered. And the diagnosis of erythroblastosis fetalis is rather easy. It is generally diagnosed within the first prenatal visit all pregnant mothers undergo. Now, treatments for this pathology can be done by way of intrauterine blood transfusion while the baby is still in the womb, or an early delivery. However, it is more common for this disease to be prevented in the early stages of development using a drug known as RhoGAM, or Rh immunoglobulin. As you can see here, picture of the box. This drug is administered in the 28th week of pregnancy. RhoGAM essentially desensitizes the child's D antigens to the mother's Rh antibodies. I'd like to acknowledge LMU, Anton, Professor Datuan. Are there any questions at this time? I would be obliged to take your questions. Thank you. 9 minutes.